Hi, my name is Caitlin. Waslowski, and I'm going to be doing a nasogastric insertion. So the first thing I'm going to do is I'm going to knock on my patient's door and walk in. I'm going to check his bracelet to make sure that it's Mr. Jones that I have as my patient. After that, I want to explain the procedure to him and make sure that he understands why this is being inserted. After he understands that, then I am going to gather all of my equipment. I need my gloves, stethoscope, NG tube, my anti-reflux valve, a syringe, and some lubricant, as well as a emesis basin, a tissue pad, and some water. After I've gathered all my equipment, I'm going to do my hand hygiene, and I'm going to don on a pair of gloves. I would get a new glove since this one fell on the ground. Then, after I've gotten my gloves on, I'm going to assess my patient, and I want to make sure to decide on which nares has the better airflow. I'm just going to plug one side and have him breathe, and plug the other side and see which one is better. This is done just in case that he's had a nose surgery in the past, has a deviated septum, or has any polyps. After I've decided which one is the better nostril to insert, I'm going to take a measurement. I'm going to take and go from the tip of the nose with the tip of the tube, go to the earlobe, and then I'm going to go down to the xiphoid process. So once I've gotten there, I'm going to take a piece of tape and I'm going to tape it around so I have a measurement of how far I'm supposed to insert the tube. I'm going to raise the bed to a comfortable position for me, and I want to have the patient in a high Fowler's position and the head of the bed at a 30 to 90 degree angle. I'm going to take the tube and I'm going to wrap it around my fingers so I can get it to have a little bend in it. This will help with the insertion of the tube. So I'm going to take my anti-reflux valve and I'm going to clamp it. I'm going to put a little bit of lubricant on the end of the tube, and I'm going to get ready for insertion. I'm going to have the patient's head hyperextended, so when I'm inserting it, it's a little bit easier. So I will insert the insertion into the nose, and I've chosen the right side because it has a better airflow. So I'm going to start inserting, and I go about 3 to 4 inches. And I'm going to stop. The patient may start gagging, but if it hasn't, still stop at 3 to 4 inches and just let your patient rest. So once I've gotten, had him take a little rest, I'm going to start inserting the rest of the way, but I'm going to have the patient have his chin go down, and I'm going to have my assistant give the patient drinks of water. You can use ice chips. It just helps to advance the tube a little bit better down the throat. And if your patient is unconscious, you want to take his head and point it down. This will help from advancing the tube into the trachea. So now once he's swallowing or drinking, I'm going to say swallow, swallow, and have him keep swallowing until I get to the taped off measurement that I had. So then I'm going to take, and I want to have a piece of tape that I'm going to tape the end of the tube to his nose, and I'm going to take one side and wrap it around. And this just holds it in place while I'm doing the placement check. So what I want to do next is I'm going to listen to see and make sure that it's inserted into the stomach. And all I'm going to do is I'm going to take my syringe and get 5 to 10 cc's of air, and I'm going to unclamp it, and I'm going to insert the syringe in there, and I'm going to listen and insert. You're going to hear a swishing sound, and that is a confirmation that you're in the stomach. Another thing that you can do is you can take and aspirate just a little bit of stomach fluid, and after I'm done with that, I'm going to take it out and I'm going to reclamp it, and I'm going to take that aspirated fluid, and I have a pH strip here that I'm going to put the fluid on, and the pH strip, or the strip, will tell me what the pH of the stomach is, and when you're in the stomach it's usually a 0 to 4. So once I've done that, I'm going to hook up the suction machine and usually when you hook it up right away, you won't notice, but the tube usually sticks to the lining of the stomach. So again, you're going to take another 5 to 10 cc's of air, and you're going to unclamp it, and this is the only time you insert air into the blue tube. So I'm going to insert the air, and I'm going to reclamp it and have it all hooked up again. At this time, you can take the other piece of your tape, because you know that you're in the stomach, and you can make sure that it's wrapped around so it's connected. Then you can take another piece of tape, and you're going to make sure the tube is a little bit flexible here, and you're going to just tape it to the patient's shirt, and using a pin, so then it won't keep him from doing anything, or maybe accidentally pulling on it to tug it out. So after that, you want to get rid of all your equipment and ask him if he is having any discomfort, and if not, then what you want to do is you want to document that you inserted the tube and any other documentation that needs to be done. I'm going to wash my hands after I took my gloves off, and that should be the insertion of a nasogastric tube.